Senator Pratt.
Deputy President. Well, flawed and dangerous. Well, that is exactly how I would describe those who've put forward this MPI motion today. Senator Roberts has, in this motion, described the Medevac legislation as flawed and dangerous, just like One Nation. This legislation passed by Labor and the crossbench has already been proven sensible, humane, simply designed to ensure that people who are sick, who need health care, while remaining in the security of Australia's borders. It's sensible and logical legislation that allows those who are unwell, in ill health, to be given the medical attention that they need. We don't want to see further deterioration or complication in their health issues that could lead to serious negative health outcomes. And we've actually seen clear examples of that being the case in our offshore processing regime. Denying people the health care they need is clearly dangerous and flawed. Senator Roberts seems to have forgotten the mechanism by which the legislation works in practice, so shall we outline them to the Senate again one more time? The legislation, Medevac, can only be used by 2 or more independent doctors. They should always have the objective authority on health matters, in my view. A person's health and well-being is, if it's in critical condition and in need of urgent medical attention, who should assess that? Well, clearly it should be a doctor. Now, what we've seen in the previous model is that doctors would provide advice, but that would then be referred to various bureaucracies and government departments to work out whether arrangements should be made, but essentially became an act of veto over an independent medical assessment. So clearly what's designed to happen under this legislation, and it's working quite well, is that the Secretary of Home Affairs is advised that a patient needs to be brought to Australia for medical treatment. This process ensures the Home Affairs Minister has the discretion required in relation to bringing that patient into the country on the grounds of security, public safety and character grounds. So, for example, where a patient might have a criminal record and would expose the Australian community to a risk of criminal conduct, that transfer can be denied. They may also deny entry due to security concerns through the advice of the ASIO department, or if the Minister or if ASIO advises the Minister the transfer of the patient is prejudicial to the security of Australia. And this threat can't be mitigated, therefore, and this, in fact, is a veto right the Minister is yet to use. So these issues, these solutions were embedded in the original Medevac legislation, and that is how the Act is currently operating. We did this because we understand the importance of national security, we understand the importance of deterrence at our borders, and we understand that the need for ministerial discretion in some cases was imperative. What One Nation and the government are trying to do is, rather than work with the process which is currently working well, which has nothing to do with floodgates to Australia, in fact has only led to 90 approvals, in fact, being made by the Minister. The Minister who is acting according to the rule of law in making approvals upon doctors' advice to admit people to Australia for proper treatment. 90 people who Minister Dutton would previously might have refused treatment have now been able to come to Australia for treatment. So the legislative framework of Medevac has enshrined patients' access to medical treatment in Australia only where it's appropriate, only where that medical treatment and appropriate treatment has not been accessible in the place of offshore processing. One nation's aim to repeal these Medevac laws altogether is simply another thing that strips away the dignity of asylum seekers who are dealing with serious medical issues. As raised by the Asylum Seeker Resource Centre, an organisation which supports those seeking asylum, they've described the process outlined in the legislation as rigorous, independent and transparent. Medevac can be seen to be working. If I had expected more from One Nation, I would be talking about how this kind of brazen disregard for human rights in our nation is shocking. But I don't expect more from them, nor from this government. One Nation's track record on disrespecting the rights of all of those different from themselves, like their positions on First Nation people, LGBTI rights and immigration, well, of course, their position on asylum seekers would continue to see them suffer in detention centres and preventable causes of ill health and death. But clearly, we can't forget in this place that it's not just One Nation who, it seems, would prefer to prevent people getting the medical care they need. The government itself would like to repeal this legislation. Minister Dutton has expressed his desire to repeal it. Minister Dutton, who's consistently misled the Australian people, who has bleated about how people coming to Australia, who has bleated about the weakening of Australia's borders. Well, there is no weakening of Australia's borders with these laws. It's very clear that anyone who arrives by boat or attempts to arrive by boat now or in the future is simply not eligible for transfer under the Medevac legislation. It only applies to those people who are already on Manus and Nauru prior to the legislation being enacted on the 1st of March in 2019. What we've seen is none of the catastrophic events, politically motivated statements of how catastrophic this was going to be. None of that has ensued since this legislation came into being. But Minister Dutton does not care about that one iota. They don't seem to care that Medevac legislation is actually working. They don't care that they have a right of veto already for anyone they think is a threat to this country. And they clearly really don't care that by repealing this legislation there will be, Madam Acting Deputy President, a very real and inhumane impact from the repeal of this legislation. It clearly appears that the only thing that this government cares about is continuing a political tantrum that occurred earlier this year and last year when the bill went through without them, when human rights triumphed over their fear and prejudice that was peddled by the government. They were left out and hurt by progress and fairness being implemented without them. So here we are today, suffering through another backstep in creating a fair society due to the government's inexplicable feelings of relevance deprivation. As has been shown time and time again when this bill was passed and in the subsequent months since it has been implemented. Medevac's not an attempt to bring all people in Papua New Guinea and Nauru to Australia who are in offshore processing there. It is not a bill to weaken our borders, and it clearly has not done so. It is certainly not a bill for the government and its stooges to use to enact revenge for their past losses. It is a bill to allow people who need to receive treatment that they most definitely require.
Thank you, Senator Pratt.